The term value-based healthcare actually is one that is now getting some level of consistency in understanding, but at first, in early discussions, often people have different views of what value-based healthcare means. Michael Porter's is the one that we are following and we are completely in agreement with. It's the health outcomes that are achieved that matter to patients relative to the cost of achieving these outcomes. But essentially, it's creating a system where payments happen when outcomes are achieved. Today's systems, the overwhelming majority of systems in every country around the world, does not operate that way. They're all procedure-based. In other words, you do something, you get paid for it. Whether what you did had the desired result, there's no accountability. And it doesn't take a leap of faith to understand that if that sort of behavior is then extrapolated across thousands and millions of procedures around the whole world, you can see how much wastage there's going to be because no one's really accountable for the result of what they did. If it's done right, it'll increase efficiency not only in the delivery of care, but in our engineering efforts, in innovation, in all of those areas, because then innovation will have an outlet where the value of that innovation is immediately rewarded. And if that innovation does not meet its objectives, it isn't rewarded, and you can go and correct it in a more efficient fashion. So if this is done successfully, we will simply have better lives, longer lives, happier patients, and I just don't see how anyone can argue with that goal. Medtronic cannot drive value-based healthcare by ourselves. It requires partnership with others. We cannot change the healthcare system by ourselves. We don't control all components of healthcare. There's no way in which any single entity does do that. And so this requires an alignment of views and a common understanding, and then a movement in that direction. And that really is the essence of what we're trying to do, is to create a systematic framework that we can use, that we can align on, that we can agree on. And then we'll decide as we go forward what our respective roles are and how we partner with each other. And that depends on circumstances. Healthcare today, in the most simple terms, is about preventing and it's about curing. You have people without disease and you've got people with disease. Both are important, but the actions are quite different. In one situation, you know your target, you've got an identified audience, an identified group of people who've got a certain disease and you can act on it. The actions in screening people and doing prevention are important but quite different. Our focus is on the top arm. That's what we do. And we know that chronic disease management actually is the biggest cost amongst people who are ill and the most actionable. And that's the biggest, most impactful, if you like, and the most expensive portion of healthcare. And there's management of chronic disease occurs in many different ways. There's intensive management. People who, without some type of management, if that's not done right, if there's a failure, the consequences are catastrophic. For example, a patient with type 1 diabetes. Chronic disease management for that patient means the correct delivery of insulin at the right time, with the right dose, on a continued basis for their entire lives. And if they do that properly, they're actually very healthy. They can participate in all kinds of activities. Their lifespans are probably close to, if not equal to, anyone without the disease, if they're well managed. On the other hand, if they're mismanaged, the immediate consequences can be fatal. Non-intensive management, on the other hand, has a little more sort of slop, if you like, a little more time. But that doesn't mean that the patient is healthier. A patient could be in a more acute state in many ways. It's just that the consequences aren't that immediate always. Obesity is an example of that. Type 2 diabetes is another example. Overall coronary artery disease is a general category is another. What I'm leading up to here is an important concept that I'll keep coming back to over and over again, is the concept of cohorts. It's a concept of specific patient populations at specific conditions, not only in diseases, but within diseases. Because in the end, if you want to go to value-based healthcare, you've got to start with that. You've got to figure out what problem you're trying to solve. And if you want to do this systematically, if you don't approach it that way, the problem is too big. Value-based healthcare will become instead an effort in selecting healthy people to lower overall cost. That's not value-based healthcare. That is not what healthcare is about.